Hi, I'm Graham from MatchMedics and welcome to our podcast, Doctor Diaries, Adventures to Ireland, where each week we have a doctor come on to tell us their own personal story about relocating to Ireland. Ranjetha, thank you so much for joining us on the latest episode of Doctor Diaries, Adventures to Ireland. Thank you for taking the time to come in to see us today. Tell us a little bit about you and your experience.
Right. Thanks, Graham, for having me on the podcast, I guess. Yeah. What my experience in Ireland so far?
Or what you're doing here currently,
right,
and then we can go a little bit back in terms of your time in Malaysia and what prompted the move here.
So I'm Ranjetha. I'm from Malaysia, and I moved to Ireland in June last year to continue my career in pediatric medicine. So I've been here now a year and 2 months now. Yeah, and I graduated back in 2017, and I was working in Malaysia for about 5 to 6 years before moving here.
Okay.
Yeah.
And how much of that time did you then spend in Malaysia in pediatrics?
About four plus years, I would say, because
Okay.
the first 2 years were internship, just doing the rotations and everything. So
Sure.
then the 4 years after that, I've only been in pediatrics. I've not gone back to adult medicine.
What was your calling to peds? Because I know it's a bit of chalk and cheese for a lot of people.
Yeah, it is. Like, not everyone would be comfortable with it.
Yeah.
Honestly, when I was in medical school, I didn't like it.
Okay.
I really, how people say never? I think that's what happened to me.
Okay.
Yeah. So I was like, I'm never doing this. But then I got into my intern period rotation in peds, and I was like, I think I actually like this. Like, people were really nice, consultants were really nice, and the fact that you see kids every day, I think it's a plus, in my opinion. So
Okay.
I decided to roll
Yeah.
with it. Yeah.
Amazing. And then that's what spurred you on then to pursue, a standalone position in pediatrics from there.
Yes, exactly. So
Okay.
yeah, back in Malaysia, so once I got into pediatric department, then you're considered to be training already over there.
Okay.
Yeah, so you just have to do your papers, like your UK papers or whatever you have got going on, and then
So your MRCP,
yeah, we do
CH,
MRCP CH back
Okay.
in Malaysia, yeah, and then from then on you just get into the parallel pathway of becoming a consultant. Yeah.
Okay.
Yeah.
So it's immediate, straight after your intern.
Yeah, so it's very much self-directed as well.
Okay.
Like if you want to do the parallel pathways, you go ahead and book the exams and study for it, and take your own time and prepare for it basically.
Okay.
But if you're gonna do it via like a proper government pathway, if you want to say, like a structured one, there's a master program, but that's a bit more competitive, and people sort of don't really do it very much because you're then bonded with the government of another 10 years.
Okay.
So that's not fun. But yeah.
Okay. And I've heard that review of the pull to a training position, but then of course there is that attachment to the system for that period of time.
Yeah, so like previously, if you do the parallel pathway, like you would just come out of it, be a consultant, and you're not bonded to anyone. But now,
Okay.
I think for the past two years maybe, they've sort of made it compulsory. Like whatever pathway you're going to do, you're going to be bonded to
And
the
why is
government.
that?
They're trying to retain doctors in probably this is not the right way to do it, but that's the aim of. They're trying to
Okay.
retain consultants because they're losing to the private sector.
Okay.
Yeah.
So they're losing them to the private sector as opposed to internationally, or is it a combination of both?
Yeah, private and also international.
Okay.
Yeah.
By the sounds of it, particularly in your case, it's done the opposite effect.
Yes,
Yeah.
exactly. Like I will not know. Yeah, I wouldn't want to be bonded. No.
Okay. So what moment appeared in front of you where you thought, I want to move to Ireland? Where did that stem from?
That's a bit of I took a winding path to get to where I am today,
Okay.
but essentially I was just sort of thought about continuing on in Malaysia. If I was going to specialize in Malaysia and be a consultant, it would probably take me like an additional 4 years maybe, which is a fairly short period of time.
Yeah.
But I feel that I would really burn out because the hours and the pay isn't that great, and if you really want to have a good quality of life, it will only probably come to you 20-25 years down the road when you've set up a practice maybe and you're comfortable, someone's running it for you in the background. That's when you can actually get a proper quality of life, and that's just something I don't see myself doing.
Sure.
If I have to slog for like 20-25 years, I think it's a bit too much.
So that's the guts of your career, really, isn't it?
Yeah, exactly.
Well, a good portion of it.
Yeah. So then I was like, let me look at, and I was like considering options basically. So the closest to us obviously is Australia. Australia itself has its own drawbacks. Like I have to start all over again. I have to do rotations like an intern.
Okay.
So after 5 years of qualifying as a doctor, I think it's probably not a wise thing to do unless you're really hell-bent on moving to Australia. Then yeah, probably fine. Then UK maybe, but they don't pay the doctors really well. And then Ireland, by like a randomest chance, I was on Facebook scrolling and I saw like an ad that said, I think it was from MatchMedics. I was like, an ad that says like moving to Ireland without any exams and things like, and Malaysia was on the list, and I was like,
yeah,
is this right? And I went and did my own research on IMC website and everything, and I was like, oh, okay, so this is an option. So that's how I then started the process of moving.
Okay.
Yeah.
So is that eliminated barrier, so the no need to have exams, is that's not very well known in Malaysia? Or?
It's not very well known. Like it wouldn't be very common for like a Malaysian doctor to move to Ireland, because most of us graduates from like international graduates would be from UK or Australia, and some of them are from Galway, but they tend to just go back. They're like they have like a training program with the Malaysian university, so they sort of they do half in Galway and then in Malaysia, and then they just sort of stay back in Malaysia.
Okay.
Yeah.
Okay.
So it's not really popular, I would say.
And
now it is.
it is quite popular now, yes.
Yeah, now it is.
The Malaysian doctor community is definitely growing with pace.
Yeah.
And you're part of that movement then, yeah.
Yes.
So bring us then up to then when you engaged with ourselves, we got you the job, and talking about your first job here in Ireland.
Yeah.
Then talk us through that.
Oh, that was there was a bit of a. Do you remember? It was I was supposed to be in Gen Peds, I think, in my first rotation, and somehow I think there was like some miscommunication. I ended up in emergency medicine.
Yes.
And I was very, very anxious about it, because I've not had emergency medicine training in pediatrics per se. Like my last experience was in adult medicine, and that was totally different. So I think
it was a bit of a chess game at the time, wasn't it? Where can we put this SHO into the various spots, and you were one of those pawns in that game. Yeah.
But honestly, it worked out really well for me.
Amazing.
I think I was actually very grateful that I did emergency medicine. So I got Temple Street, CHI Temple Street, apparently one of the busiest emergency medicine departments in Europe. Apparently.
Pediatric emergency.
Yeah, pediatric emergency in Europe apparently. So I was like, okay, that's going to be tough. But I got here and met the consultants, met my colleagues and everything. The thing is, like, obviously I was anxious about, learning a new system and how things work here, how the management would differ by a bit maybe, compared to back home. But everyone was very, very welcoming. They gave everyone the chance to, like, learn things their own pace and, get used to the system and things like that. I never once felt like anyone was rushing me to do things, or like, to quickly pick up things that I was supposed to pick up and things like that. So I felt like I felt really welcomed actually, and very, very supported is
Great.
what I would say. Yeah.
And what have you found being the biggest difference between practicing pediatrics in Malaysia versus Temple Street?
So I would say probably the way how there's a lot of reassurance involved when it comes to in pediatric emergency medicine, I would say, because a lot of the time I would say in Temple Street we don't really admit everyone, because a lot of them are just reassurance, make sure like everything's okay, speak to the parents. There's a lot of talking, a lot of rapport building, I would say.
Okay.
But back in Malaysia, because volume is just so high, just sort of get on with it, just come in, what's the issue, get it done, get it fixed, bloods in, like admission or not, and then that's it. So I would say that I take a longer time here to speak to parents and to like explain to them what's happening, like build a relationship with them, which is something I never really did back home because we didn't have the time.
Okay.
Yeah, so that's something I find different,
So
but I like it.
Pleasant surprise.
Yeah. I didn't think I had it in me. But yeah, I did it.
So you're testing yourself. You found another skill within you. Yeah.
Exactly. Yeah.
So you started in Peds Emergency. Then take us through where have you moved on to since?
Then that was Peds Emergency was in June up till January this year, and then I moved on to neonatology in CHI Crumlin.
Okay.
So that's where I was in from January till July this year, rotation. So that was a bit of a surprise as well, I think, because in my experience, neonatology was more of the kind of experience you would have in the maternity hospital, like
Sure.
in the Coombe or in Holles Street, you know. But this was a lot more different because we took care of, we were managing the post-surgical care babies,
Okay.
or post-cardiac surgery babies, you know, and like airway babies, like your ENT babies and things like that. So it was a bit different than what I'm used to. But again, I learned a lot. You learn how to communicate within, between different teams, how you get everyone together, get a plan for the baby, and send them home with all these things already tied up nicely, basically.
Okay.
Yeah.
And then to your current role, then, so you've done. For anyone unaware of the system, rotations tend to happen either every 6 or 12 months. For you, you've managed to stay within. You've been quite fortunate, I have to say, stayed within Dublin, within the CHI,
Yes.
so the Children's Health Ireland group, and you're rotating around a few of those facilities and a few different subspecialty departments. You're now currently in what subspecialty?
So I'm currently now in neurology.
Okay.
In CHI Crumlin as well.
And how is that? All encompassing those 3 subspecialties, how has that upgraded your skills from when you moved here in the first place?
Well, I would say that I'm a lot more well equipped with the system. I know how things work within CHI itself. It's just a lot more. It's a lot easier now that you know everything how things work, and so it's easier now in the sense that I've seen neonates and I've seen emergency medicine cases. So when you have a neurology presenting to the emergency department, or a baby presenting to the emergency department with like a seizure or anything that's neurological, that sort of ties things together quicker for me in my head.
Okay.
Because I've done this, and so I can connect the dots easier. Yeah. So I think in that sense, definitely did add value to my current rotation. Yeah.
So, in essence, probably starting off in emergency in Ireland was a good framework or a good base level to start off with, to get to understand the different landscape. Of course, patients are the same, right, wherever they might happen to be, but the way of treating them might be slightly different, and the systems and the resources available might be different to you. So again, going back to the differences between the two systems, when we talk about a resource, dare I say, rich environment perhaps that you are here by comparison to Malaysia, how was that change for you?
I would say access to certain things is definitely sort of easier here, I would say. Like, for example, I'm going to take a neurology case, for example, now. Like, if we were going to get a patient comes in with like is it a seizure, is it not a seizure, and you want to investigate and you have to do an EEG, we can get it done like if the patient is an inpatient, we can get it done on the same day or the next day, and we can get the results within the week, basically. Or we can send the patient off for an MRI of the brain, and we probably can get it done within the week as well. But now the same situation back in Malaysia, that is actually almost impossible, I would say.
Right.
Yeah, just to get the EEG, like, we can get it done, but no one's going to report it until like 3-4 weeks down the road. So, it's really no value in doing the EEG that soon. And then MRI, probably like a month out before you can get it done, unless it will only be done urgently when it's an really urgent cases.
So as a doctor, I imagine it's not a comfortable space to be in, where you're having to decide on the urgency of a case and having to differentiate between 4 or 5 different children ultimately, and who needs the care the quickest and best care as possible.
And there's always a long line, always.
Long line, so that, I'd like to think, probably, is it a welcome change? Is it a nice change to have that you're not having to play God to a degree?
Yes, of course it's a welcome change. I definitely appreciate that, the fact that, and everyone's very hands-on with everything. You don't just work with doctors alone. There's like a lot of clinical nurse specialists involved as well. They're really good. They support patients. They give advice over the phone even. So it's like you're not overwhelmed with a lot of things at the same time. So
Okay.
the jobs are very specialized. They're like, they're well divided among the team. So things like that, you don't feel like you're doing everything, which is what I would have done back home.
Okay.
Yeah.
So a lot
It's
more of
definitely
a
welcome
team, multidisciplinary approach as opposed to working independently, still as a junior doctor,
Yeah.
but working independently.
Yes, exactly. Yeah.
Okay. And where to career-wise next for you? You very clearly, for as long as I've known you, you have a plan.
Mm-hmm.
What's your plan here career-wise in Ireland?
So I'm gonna try to get onto the training scheme.
Okay.
So it's the BSD. They should applications should open somewhere in September, I think, and the intake will be next year July. So it's going to be the first 2 years of basic training, and then subsequently another 4 or 5 years of higher specialist training.
Okay.
Yeah, it's going to be a long road. Like it's going to be 6-7 years.
Yeah.
Like from here on out, if I get into the BSc program, but I think something that needs to be done, and it's a structured program. Just it's worth just go through it. Yeah.
So you very much see yourself here for at least the medium-term future to be able to complete
exactly,
that.
Yeah.
So
I do.
you're part of the furniture, some might say.
Yes,
here.
part of the furniture. Yes.
Amazing. Okay. Well, look, we might now jump into life in Ireland, and then you've been here for over a year, and get a better sense of how you've thrown yourself into the local community. And if we can go back to your first day or first week here, what was the biggest surprise that you found when you first reached Ireland?
I was actually, first of all, jet lag. I was surprised that's going to be like 4 or 5 days getting over it. But second is how, because when I moved here, I was living with a host, and it was just me and her in her house, basically. She's a really sweet old lady, 65 years old. And I was just so surprised how welcoming she was. Like, I'm literally a stranger from across the world, and she opened her home up to me, and she taught me all the small little Irish things that like how you go up to someone, you're like, hi, how are you?
Okay,
although you don't really expect a full-blown
normal
response.
greetings.
And how things like small tips and tricks, things like that, so which I really, really appreciated, and she really took care of me really well. So I was very surprised as to how welcoming most Irish people are. I don't think I've met anyone who wasn't. I don't think I have. That was something really surprising. I mean, as coming from Malaysia, I feel like we are a group of warm and friendly people, but I think you guys are a lot more warm and friendly.
We'll take that. Yeah, thank you. We'll take take that compliment.
Yeah.
And I guess, what moment did you have where you thought, I can see myself here settling long term?
I would say probably over the last 6 months.
Okay.
I've sort of got into it, like my own routine and things, and started exploring Ireland, and how I feel like I could actually stay here, get into the lifestyle of being in Ireland, because you guys have beautiful mountains, like hikes are beautiful here, like the beaches are beautiful, and I'm sort of got into being like a nature-ish kind of person moving here.
And were you before?
No.
Okay.
No. I was I didn't really have the opportunity. Like, I was living in KL. It's very much like a concrete jungle. So I find myself loving these things, and I was like, I could stay here for this. There's a lot more to explore. Like, the whole country is up for grabs. So I'll
lean into that one a little bit further then. If you were to recommend anywhere in Ireland for a weekend or a long weekend trip, where would your top place be?
Funnily enough, I was in Kerry last weekend, and I was in Ballyhike, and then I took a trip to Dingle, and I think that's somewhere I would love to spend a weekend at. With nice weather, but
we've asked a few guests, or all our guests, that question this season, and Kerry is the most popular appearing location. So there's something to it. There's some draw to it there. And if you were to describe your time in Ireland in 3 words, what would they be?
They would be warm, which is not the weather, but the people.
Yeah. couldn't shy away from mentioning the weather. Yeah.
Yep. Of course.
Yeah.
And the other word is supported.
Okay.
Yep. And the third is, I was looking for the third word actually, but I couldn't really get one.
Yeah.
But yeah, what did I say? I'd say calm. Yeah.
Okay.
Like calm and laid back, I would say.
Coming from such a big city as you did to our capital city, Dublin, I'm sure you can confirm for everyone listening or watching that Dublin, still being capital city, is still quite small and very accessible.
Yeah, very accessible. Yeah, I think if you just move out, maybe if you're like 2 kilometers out of the city center, it just starts to calm down, and it's not as noisy or like as congested as it can be. So I think I like that. Yeah.
Great. Okay. Yeah. Well, I think we all need another trip down to Kerry, I think, to take in those sites. And in your year and a bit here, what's your proudest moment being as a solo relocator? What moment stands out to you to say, well done me, well done for doing that?
Well, I would point out to one specific moment, which probably I don't know if it's significant, but to me it was. It's when I hiked Glendalough, and I was up there, like on the top, and it was a beautiful day, clear skies, and I looked at the lake, the lake down there, and I was like, here I am, like this many miles away from home, and like I'm thriving, and I'm proud of myself. Yeah. So it was like that moment, kind of in nature.
So physically and metaphorically, you'd reached a summit.
Yes, a summit, exactly. Yeah.
And I've been there many a time. It's just up the road from where I live in Greystones, and on a clear day, it's an amazing place to be up on. So it's good to hear that you've had the same positive experiences. So we're going to jump into a little bit more of a funner interactive segment of our chat now. Sure. Ahead of time, I'd asked you to pick out a picture on your phone that sort of summarizes your adventure here so far. Care to share one of those pictures?
Just like 2 seconds.
Yeah. Amazing. So tell us.
That's
the summit that's in Glendalough.
Yes.
Wow.
Exactly.
Yeah. What a day. You're very lucky to get a clear blue day like that.
Beautiful. It was actually kind of hot. Didn't believe I would say that in Ireland, but it was kind of hot.
I know, and that is there for a lot. That is a surprising element here. I think we've been quite lucky this summer. We've actually had a bit of summer, and you've experienced 2 summers now to know that what a good summer here looks like. So I'll ask you now to finish this sentence. I knew I belonged in Ireland when.
When I missed Ireland, when I was on a trip, when I actually missed coming back to Ireland, when I was on a trip out back in June, I was doing a summer trip around Europe.
Okay.
And I was like, I actually miss going back to Dublin. Yeah.
Amazing. Okay.
Yeah.
And are you close to saying this is your home away from home?
Yeah, definitely it is.
Yeah.
I'm going back home in October, but I have a feeling that after like probably 2 weeks, I probably might start missing Ireland.
Okay.
Yeah.
Amazing. That's great. Our next bit, people are forever asking, do you all speak Irish? Do I need to learn Irish to be able to work here and live here? And gladly, I'm sure you'll agree, that is not the case.
No, it's not,
but there is Irish littered throughout our daily lives. So we thought of a fun little segment where we might test your knowledge of that, whether it be a place name or a person's name or slang perhaps that's used that you may or may not have come across, and see how best you can can pronounce it, and what you associate with it. So this is a person's name.
Okay. Oisin.
Oisin. Okay, yes, we'll give that to you. So one from one out of 3. This is a place name. Gather you've been there before.
It's Howth.
Well done. Okay, two from 2, and most people, we picked that one because most people naturally would say Howth because that's
How?
the normal formation. But either way, that is Howth. And this one, I'm sure you definitely know.
Slante.
Yes, Sláinte. Yeah.
Sláinte.
So what is your association with that word from your
Uh,
Irish experience so far?
Like cheers.
Yes.
Like, with a pint of anything Guinness.
Yeah. Yeah. It's
Yeah.
I guess for many it's sort of casual greeting, a casual welcome, a
Right,
casual cheers.
Yeah.
Yeah. So you've come across that a few times in your time here?
Yeah, like a few. I feel like one of the first few times I've gone out with some of my colleagues, and they taught me this.
Okay.
Yeah.
Yeah,
So
it's
they taught me this.
a good first thing to get into your Irish arsenal.
Yes.
So before we finish up, I'd love to know if anyone, perhaps in Malaysia or anywhere else in the world, what one piece of advice would you give to them if they're considering making a move to Ireland?
I would say do it. I would say do it. It's if you're already considering a move out of the country, it means that you are already thinking of uprooting your life, and you're comfortable with that. So if you already have that kind of contemplation going on, I would say just go for it, because things here are definitely better in terms of work-life balance. You do get paid better. Of course, the first 6 months are probably going to be a little bit tough, trying to get used to things, trying to get used to the culture, trying to get used to the food and everything. But I would say do it, because if you don't do it, then you'll regret it down the road. You'll be like, what if I moved to Ireland, all those years ago? So I'd say if you already have the thought of it, just do it, because in terms of career, you would have a fairly better chance of progressing here. Yeah.
Okay.
Yeah.
Amazing. Thanks so much for coming on and sharing your story. And no doubt, as the growing number of Malaysians look to Ireland as a place to potentially move to and continue their career,
Yes.
they will find real value in our chat today. So thanks for sharing.
Right. No problem.
Thank
Thanks
you.
for having me.